What if the mucus you keep clearing from your throat isn't actually starting in your throat? You wake up, swallow, clear your throat, drink some water, and there it is again. You may blame dairy, allergies, or simply getting older. But sometimes, that sticky feeling can come from your nose, stomach, medications, or even the way you breathe at night. And the most frustrating part is that you can keep treating the mucus while completely missing the reason your body keeps producing it. Let me tell you about Robert, a 68-year-old man who cleared his throat before phone calls, before speaking at church, and even during breakfast because it constantly felt like something was stuck. Robert wasn't sick. He had no fever, wasn't coughing all day, and his lungs had never bothered him. He tried cough drops, honey, avoiding milk, and allergy tablets. Nothing lasted. Eventually, he decided it was simply another problem that came with age. But his doctor discovered several clues that had never been connected. Robert's nose was congested at night. He snored heavily. He ate dinner late. And he had started a medication months before the throat clearing became noticeable. The lesson isn't that one of these things was definitely responsible. The lesson is that persistent symptoms deserve investigation instead of automatic acceptance as a normal part of aging. Here's the basic principle. Mucus is usually a defense mechanism, not an enemy. Your airways need a moist protective layer. Your nose filters incoming air, your sinuses produce secretions, and your throat helps move material toward your stomach. When this system becomes irritated, dried out, or disrupted, you suddenly notice something that normally happens silently. The first overlooked reason is mouth breathing during sleep. Many people unknowingly breathe through their mouth because of nasal congestion, allergies, snoring, a deviated nasal passage, or sleep-related breathing problems. When your nose isn't moving air comfortably, your mouth becomes the backup airway, and hours of mouth breathing can dry your throat. That dryness can make normal secretions feel thicker and create the sticky sensation you notice every morning. You don't have to wake up gasping or remember breathing through your mouth for this to happen. Your partner may notice it before you do. If you regularly wake with dry mouth, bad breath, and thick secretions, consider discussing nighttime congestion or loud snoring with a healthcare professional. The second contributor is dry indoor air. Heating and air conditioning can reduce humidity, especially during the night. You may spend 8 hours breathing dry air without realizing your bedroom environment is irritating your nose and throat. If symptoms become worse during winter, don't automatically blame the cold. Your heater running all night could be part of the pattern. If the air is very dry, keeping your sleeping environment comfortably humidified may help some people. But humidifiers must be cleaned carefully because poorly maintained devices can develop microbial buildup. Also, make sure you're getting adequate fluids throughout the day. The goal isn't to force excessive amounts of water, but to avoid becoming unnecessarily dehydrated. The third contributor involves everyday habits. Coffee, alcohol, very spicy meals, tobacco smoke, and other irritants can repeatedly bother an already sensitive throat. You may keep treating the mucus while continuing the habit that irritates the tissues. Instead of eliminating everything at once, change one variable at a time and observe what happens over a couple of weeks. The fourth contributor involves swallowing. As some people age, swallowing coordination can change. Liquids, food particles, or saliva may not move as efficiently as they once did. Not every swallowing problem feels like choking. Some people notice coughing during meals, repeated throat clearing, a wet-sounding voice afterward, or the sensation that food isn't moving down normally. Consider James, who repeatedly coughed whenever he drank water. He assumed it was mucus, but his clinician noticed that the coughing happened specifically with liquids. That changed the entire conversation. If your throat clearing consistently occurs while eating or drinking, or you experience choking, coughing during meals, or unexplained weight loss, don't assume it's ordinary mucus. Talk with a healthcare professional. The fifth contributor is medication-related dryness. Some medications can cause dry mouth or alter the way secretions feel. When your mouth becomes dry, saliva and throat secretions may become thicker. This can create the impression that your body is producing much more mucus, when the real issue may be a change in consistency rather than quantity. A medication you've taken for years can also become more noticeable when other factors change, such as hydration, aging, illness, or other medications. Margaret noticed her throat became sticky after a medication change. Instead of stopping her prescription, she wrote down when the symptom began and discussed the timeline with her pharmacist. Never stop an important medication on your own. Now here's the calming part. Persistent mucus does not automatically mean something serious. Common causes include nasal irritation, allergies, dry air, reflux, infections, medications, and environmental triggers. The goal isn't to become frightened by every throat sensation. The goal is to stop ignoring a symptom that has become persistent and start looking for patterns that may explain it. Think about your own symptoms. When is the mucus worst? Right after waking? After meals? While lying down? During winter? After coffee? Or while eating? Timing can provide useful clues. For 7 days, keep a simple diary. Record when symptoms appear, whether you wake with a dry mouth, whether you snore, what you eat and drink, and whether throat clearing happens during meals. Also record any recent medication changes and whether you have nasal congestion. Then take this information to your doctor or pharmacist. If reflux seems possible, avoid lying down immediately after large meals and discuss persistent symptoms with your healthcare professional. For nasal symptoms, saline rinsing may help some people, but use sterile or distilled water or properly boiled and cooled water. The good news is that you may not need a complicated solution. Sometimes the answer is improving nasal airflow. Sometimes it's changing your bedroom environment. Sometimes it's identifying a medication effect. Sometimes it's treating reflux or allergies. And sometimes the biggest breakthrough is realizing that what you've been calling mucus is actually connected to a different underlying problem. Remember Robert? Once his doctor understood the pattern, he stopped randomly trying remedies. He addressed his nighttime nasal symptoms, changed his late evening eating habits, and reviewed his medications with his healthcare team. His throat didn't become perfect overnight, but gradually the constant throat clearing became less important. He finally stopped asking, "What's wrong with my throat?" and had a plan. So remember, don't fight the symptom until you understand the signal. Persistent throat mucus can be influenced by mouth breathing, dry air, irritating habits, swallowing changes, and medication-related dryness. Look for patterns, timing, medications, swallowing, and nighttime symptoms. If you know someone who constantly clears their throat, share this video and comment. Morning, after meals, all day, or at night. Seek medical care for breathing difficulty, blood, progressive swallowing problems, unexplained weight loss, a neck lump, or significant persistent voice changes.